Bismillahirrahmanirrahim. Assalamu alaikum. My name is Maryam Akram and I belong to class Final Prof Morning. My roll number is BP1650125 and the topic of my assignment is drug dexamethasone. Today I'm going to explain about you all what is dexamethasone. Dexamethasone belongs to a class of drug called corticosteroids. It is an oral tablet which is available both as a generic and brand name drug. Dexamethasone comes as an oral tablet, oral solution, eye drops, ear drops. It is available as an injectable solution or intraocular solution given after surgery. Pharmacologically, it is a corticosteroid. If we talk about the therapeutics, it is systemic anti-infective. Pharmacodynamic is by decrease inflammation, suppression of migration of polymorphonuclear leukocytes, and reversal of increased capillary permeability suppresses normal immune response. Pharmacokinetics is oral absorption is about 90%, metabolism is slow via liver, renal excretion accounts for 60%, plasma half-life is about 3.6 hours. Now, indication. Dexamethasone oral tablet is used to treat many conditions like inflammation, allergic reactions, ulcerative colitis. They also include adrenal insufficiency. Contraindications may include allergic reaction, heart damage, infection for the people who have congestive heart failure, with high blood pressure, with peptic ulcers, for the people with osteoporosis, for people with hyperthyroidism, eye problems, tuberculosis, recent history of heart attack, for the people who are having diabetes, the pregnant women, the one who are lactating, that can do breastfeeding as well for the older adults. So, like, these are the contraindications for of dexamethasone. Side effects: upset stomach, stomach irritation, vomiting, headache, dizziness, insomnia, restlessness, depression, anxiety, acne, increased hair growth, easy bruising, irregular or absent menstrual periods, skin rash, cold or infection that lasts for a long time, vision problems, black or tarry stool. Basically, these are all the side effects of the corticosteroids. You can also see in this picture. Now, drug-drug interaction. Basically, dexamethasone can interact with other medications. It could be vitamins, herbs, or you may be taking. This can be harmful or prevent the drug from working well. These include antibiotics, especially erythromycin, antifungal drugs, amphotericin B, blood thinners, warfarin, cholesterol drugs, Cushing syndrome drugs, diabetes drug, diuretics. Basically, these are the water pill drugs, epilepsy drugs, heart drugs, hormones, HIV drugs. NSAIDs may include aspirin, ibuprofen, indomethacin, naproxen, tuberculosis drugs. Basically, these are all the drugs that we can't give to them with the dexamethasone. And in the back bracket, these all are the examples. Vaccines may include measles, mumps, rubella, intranasal flu, smallpox, rotavirus, chickenpox, yellow fever, typhoid. These all are the vaccines which you can't give with dexamethasone. Other drugs include aspirin, theridomide, cyclosporine. Antidote. Basically, there is no specific antidote for dexamethasone, but the treatment of overdose is by supportive or systematic therapy. In the case of acute overdosage, according to patient condition, supportive therapy may include gastric lavage or emesis. Now, what is emesis? Emesis is basically the process of vomiting, and gastric lavage is cleaning content of the stomach. It could be either eliminating poison from the stomach. Basically, it is a GI decontamination technique to empty the stomach. In this process, we can do like by emptying the stomach of toxic substances in a sequential administration and aspiration of small volumes of fluid, as you can see in this picture. But a small volume of fluid is given to the patient on an orogastric tube. Basically, this is a orogastric tube. By this, we are giving sequential administration and aspiration of a small amount of liquid in order to clean the stomach from the toxic compounds. So basically, this is gastric lavage, and it could be called as supportive or systematic therapy for this treatment. Irrational use of drug. In simple words, we can say it is an inappropriate use of that medicine. Like it could be an inadequate amount of dose, frequency, etc. Irrational use of drug if I talk about example, so let's discuss the example. If dexamethasone is given to control nausea and vomiting in patients who had surgery and post-operative pain, so normally given to control the nausea and vomiting will be its irrational use. Like if we are giving to the patients who have post-operative surgery, it is okay. But if we are giving just to control nausea and vomiting, that would be its irrational use, because it's an inappropriate use of that medicine. Now the second example, if we discuss, dexamethasone is suggested for patients with severe COVID-19 with hypoxia. But if we give this drug just for the hypoxemia patient, then it would be its irrational use. When there is not very much high risk for premature birth and it is suggested, so this is an irrational use of that drug. Now, alternative brands. Hydrocortisone can be used as an alternative brand to dexamethasone to treat patients severely ill with COVID-19. Glycerol, a successful alternate to dexamethasone for patients receiving brain irradiation for metastatic diseases. Meloxicam is effective for the short-term relief of pain and inflammation associated with arthritis. Prednisone effectively controls inflammation and an overactive immune system. Basically, these all are the alternative drugs that could be prescribed in case of dexamethasone. Now, the available brands may include systemic nasal ophthalmic, as you can see clearly, number 1, number 2, and number 3. And in that, you have different brand names available of different classes. Like if I talk about Decadron, this is belong to class glucocorticoid, and basically this drug is systemic. And if I talk about the nasal, that would be dexacort phosphate and tubenarine, and this is a nasal dexamethasone preparation and belongs to the class nasal steroids. Now, dexamethasone ophthalmic brand name would be Ozurdex, Decadron, Ocumeter, Dexendenza, Maxdex. These all are the brand names. But if I talk about the drug class, so it will be included in ophthalmic steroids. Now, dose variation could be range from 0.5 milligram till 6 mg. Available in oral form, IV form, and whatever you are giving to the patient that time. If I talk specifically about the doses of adult, child dosage, geriatric, senior dosage, adults, or pregnancy, I am discussing now one by one of each dosage forms. If I talk about the adult age 18 years and older, it may be given in 0.75 and 9 milligram every day, depending on the patient's condition. If I talk about the children dosage form, it would be 0.02 to 0.035 according to the body weight. If I talk about the geriatrics, it could be given in the oral, IV, IM, 4 to 20 milligram a day, increasing in 4 divided doses. Senior dosage form, as their kidneys and livers may not work properly, so this can cause your body process drugs more slowly. As a result, more of a drug stays in your body for a longer time and risk your side effects. So according to that age factor, body weight, we can prescribe the drugs to the patients. Now, pregnancy, dexamethasone and betamethasone cross the placenta with similar maternal and fetal concentrations, since they are the treatment for the choice for fetal respiratory distress. The lowest possible steroid dose needed to control disease, it should be used in pregnancy. Matlab, like if the dose should be in minimum amount, that would be better for that patient, for the pregnant woman. A standard regimen of dexamethasone that comprised 2 doses of 12 milligram intramuscular injections, 12 apart, was administered to 12 pregnant women to promote fetal lung maturation and anticipation of premature delivery before 34 completed weeks of gestation. Case study. Mr. JD, a 19-year-old university student, presents a campus GP. What is GP now? GP is basically general physician, general practitioner, other called doctor. In the afternoon with severe headache, vomiting, and photophobia since early morning of the same day. On examination, the patient has a fever and he is unable to touch his chin to his knee. He does not have a rash and is alert and oriented. The GP administered benzyl penicillin IV 1.2 gram and the patient was transferred urgently by ambulance to A&E. Mr. GD weighs 70 kg, is a smoker, and has an unremarkable medical history. He takes occasional caffeine tablets prior to examination, but otherwise takes no regular medication. He remembers receiving meningitis vaccine at school. On arrival at A&E, his vital signs are recorded as follows, like heart rate 124 BPM, temperature 39 degrees centigrade, respiratory rate 26 breaths per minute, blood pressure 95 by 65 millimeter mercury, oxygen saturation 97%. Now, what is photophobia? As I have read in this case study, photophobia basically is a fear of light. It could be like bright indoor light, can even be painful. And it is caused by meningitis, migraine headaches, eye problems, infective medications, etc. Benzyl penicillin is basically the antibacterial drug given to to treat bacterial infections, certain type of bacterial infections. Subjective. Now we will prepare the soap notes for this case. So now, first of all, subjective. In subjective, we will discuss one by one the headings. Number one, chief complaint. As there is no chief complaint but headache, vomiting, and photophobia with fever. Onset of complaint since morning of the same day. History of illness. Age 19 years. Weight 70 kg. Gender male. Medical history, the patient has unremarkable medical history, but he is a smoker and occasionally take caffeine tablets. Received a meningitis vaccine. Current medication, no current medication, but benzyl IV was given to the patient when came in emergency. Objective includes laboratory data, which is heart rate, temperature, respiratory rate, blood pressure, oxygen saturation. Now assessment investigation includes one lumbar puncture and cerebrospinal fluid analysis, CSF PCR for herpes simplex virus, blood cultures, coagulation screen, urea and electrolyte and fall blood count, C-reactive protein, liver function test. Basically, C-reactive protein is a complete blood test in which we can identify about each blood cells. Plan. Medication. The patient is diagnosed with suspected meningitis, and the treatment plan is as follows. Cefotaxime. Cefotaxime is given to the patient in 2 kilogram QDS. QDS means once a day. Cefotaxime can be given either in the vein or muscle. It is used to treat bacterial infections like pelvic inflammatory meningitis, UTI, pneumonia, gonorrhea, etc. Dexamethasone, PO per oral 10 milligram QDS once a day. It is used to treat arthritis, blood disorders, allergic reactions, skin diseases, eye problems, breathing problems, and it is a glucocorticoid medication as we have discussed before. Acyclovir IV. We give to the patient acyclovir IV of 700 milligram TDS, yani thrice a day. Acyclovir is used to treat sores around the mouth, infection caused by virus. Basically, it is an antiviral drug. Paracetamol is an analgesic and anti-inflammatory properties, and also has antipyretic properties. So, as a patient is diagnosed with fever and pain, so paracetamol would be suggested in this case. Cyclazine IV. Cyclazine IV prevent nausea, vomiting, dizziness, motion sickness, vertigo, used to avoid nausea after great anesthesia, general anesthesia, or from opioid use. Cyclazine may be given IV 50 milligram TDS as per need. Enoxaparin subcutaneously, we will provide to the patient 40 milligram OD once daily. Post lumbar puncture, anticoagulant, blood thinner, prevent DVT and PE, basically prevent DVT, deep venous thrombosis, PE, pulmonary embolism during pregnancy or certain type of surgery, coronary syndrome, heart attacks. So these are the medications which we give to the patient for for his disease. Now, if I talk about the references, so I have collected all the material and the things related to this assignment from the basic clinical pharmacology book, Bertram G. Kedzang, chapter number 36, Koda Campbell, various Google articles. By reviewing and studying various Google articles, I have prepared this presentation. Now, I hope you all got the clear idea about the drug dexamethasone, what is its indication, side effects, drug-drug interaction, and I have also discussed the case of dexamethasone with you people. So I hope now you all got the clear picture about the drug. So thank you so much.